So what we were going to do today is actually bring some information in, documented proof of some of the things we were saying, and try to make sure that it's, I guess, realized that when people become chronically ill, they have a lot of time on their hands. And they spend an immeasurable amount of time reading and comparing and researching and trying to find out what is true, what is fact, what is fiction, the newest information out there. So, we should actually be utilized quite extensively when any new health challenges are arising, because as I said, we've been doing all of the work, and I know that there's so many new things happening and so many difficulties in the province, so many little health issues that those of us that have been dealing with it for a while, and some of us have fairly substantial backgrounds that before we were sick, there's people in the health field, there's people that were in the research field, there's people that were quite valuable. And it would be appreciated if we were utilized a little bit more, because we really have spent a huge amount of time doing research. So on that, I'm going to kind of mention a few of the research documents that we came across. And
sorry to interrupt. Just help me, because I wasn't in the earlier conversation, of course. I'm Deputy Chief Medical Officer of Health here. It just helped for me to know what the kind of the purpose is. Is it to share information? Is that what we're really trying to do here, and make sure we all have access to the information?
Well, it's
if I could just I mean one of the areas, of course, and Donna, of course, in particular. I'm not sure how long you've been involved.
For about the last 4 or 5 years,
right,
with Donna. I've had Lyme disease since 2008, and
right.
I had to go to the U.S. to be diagnosed and treated, and spent a great deal of money.
Yeah.
Infectious diseases refused
so
to
they've been long-time advocates of challenging the healthcare system to work on diagnosis, treatment, and education, awareness, really the whole picture of Lyme. So they, as a group, they continue to be an advocacy group, and so they want to share with us some additional information and some areas of concern that they do have.
An improvement that the government can do, improvements that you can make, and maybe help raise the awareness a little bit more, and help us out.
Sorry, Don. We had a number of questions that we brought to the last meeting, and perhaps it would be helpful if you got a copy of those questions. Do you have those now, Don? Or I'm sure Minister Glaber and you people must have those. Perhaps if you could share those with him. And those were our concerns at that time, among many others. But we kind of got sidetracked at the last meeting and really only covered about the first two.
Yes.
Yeah, I think 3 maybe.
I just have one question at the end of this meeting. I watched the whole video last time and I've never met any of you before today, but had a very frustrating experience with Lyme myself. Was diagnosed and treated in ICU for Lyme carditis after trying to get 4 or 5 doctors I saw in Emerge and GPs on the South Shore and in St. Margaret's Bay, in an area I thought was known for having Lyme disease or known for there being cases there. Nobody would even give me a blood test to check for Lyme disease. They totally ignored it, said that's not possible. I had removed a deer tick from my own body. I didn't save it, but it was very traumatic not to be taken seriously, and I'm actually really lucky to be alive after what happened. So I don't know how many stories there are like this.
So how long ago was this?
I would have contracted Lyme in April or May. It's emotional. Of 2014. I was hospitalized at the end of July 2014 or beginning of August for about 10 days in ICU. And it didn't have to get there. All I needed was an antibiotic.
And Kate is the second Lyme carditis case that I became aware of since I started looking.
Yeah.
And I know in the States they say, or various documentation says it's very rare, but the one I've found out about first happened to be one of the first cases I heard about when I thought I was sick, and he happened to be the son of my lawyer. And he ended up with a pacemaker, and he was diagnosed with...
I refused, or I would have one too.
Yeah, I mean,
in my 20s, a pacemaker.
And he was in his 20s, and she had to fight and fight and fight to get antibiotics instead of the pacemaker, which she was strong enough to do and fight and won.
It was
and
the hardest thing I will ever do in my life to survive that, and it wasn't surviving Lyme disease. It was battling the ignorance we have about it right now, and I don't think anything's changed.
And that's just 2 cases that I've come across, so I'm sure there must be many more cases in the province. It's not just 2 cases of Lyme carditis.
I'm not even sure my case was ever reported, because there was no, I don't think anyone thought I could have possibly had anything else. I was treated for Lyme disease. My heart slowly started to rectify all the erratic beating, and my Lyme test came back negative. I don't think I was ever even reported as a case of Lyme.
So if a clinician, I mean, just very briefly, if a clinician has diagnosed you as having Lyme disease, it's a notifiable disease. So
okay. Because my doctor did inform me, oh, guess what? There's this other case of Lyme carditis. Same idea, guy in his 20s, contracted it in Bedford. It's not even in the woods anymore. It's in people's lawns.
Mm-hmm.
Yeah.
So that's a worry to us, as you know, it's young people. Obviously, I mean, older people are just probably dying of heart attacks and nobody's paying much attention to it. But when the young people are getting their heart affected and it's still not being recognized as a possible issue in the province, it's very, very scary.
Yeah.
Very scary. And actually looking at the video, I kind of chuckled to myself because we were all women of a certain age. And I was thinking that
This is at the last meeting.
At the last meeting, I'm thinking, oh, you know, we're all crazy menopausal females. So I was very happy.
Children getting this.
Yes.
They can't advocate for themselves
Right.
in Mahone Bay. And when I was being treated there, the nurses were it's just stunning that nobody's talking about this or taking it very seriously. They were saying to me, yeah, we've been frustrated for years. Every 3rd person and their mother gets Lyme here. Children are getting it. And there are some GPs, they were telling me, who have private practices in this area who, if you tell them you had a tick on you, it doesn't even have to be a deer tick, which I think is the only type that can transmit Lyme, they will prescribe that antibiotic as a precaution, even though they're not supposed to, even though I think I started asking, why are people afraid to prescribe this? Are you risking your license if you don't get a positive Lyme test back? And I did get a couple of doctors tell me that they were afraid they were going to have their licenses revoked, or there seemed to be a lot of confusion about what the protocol was, what was appropriate to do.
And this is recent. I mean, this is recent, and as you all know, in the last meeting, there was certainly the impression from Dr. Strang that things have improved and things have changed. Well, it just depends on the luck of the draw, what doctor you get when you go. That's exactly
I just kept going back.
Now.
I'm tenacious or I would be dead. And I trust myself. And I just kept going back and saying it's just going to take one person to believe me and test for this. And that's all it took. It was a young doctor in the Lunenburg Emerge, because I'd already been to the Bridgewater Emerge twice. Wouldn't even consider testing for Lyme. They did all kinds of tests. All you need is an antibiotic, and all the money that was used up on the tests they did on me. Young female doctor in Emerge in Lunenburg. At that point I walked in with the protocol someone in Mahone Bay had given me for treating Lyme disease in Nova Scotia. Because ironically, when I arrived to Mahone Bay and moved there in 2013, I had met a young couple who moved there from Ontario, and the first thing they told me, I'd love to have him here actually, I'm not in touch with him anymore, but I could be, was I met them walking my dog in the woods there, and they warned me about Lyme. They said, be very careful, we see you walking your dog in the woods. When we arrived here, the boyfriend, I don't think he was a husband, and they were young, in their 20s, late 20s, both the boyfriend and the dog immediately got Lyme. And he said he fought and fought and fought for somebody to take it seriously. Over months, the same thing that happened to me. And I kind of listened to this story and I thought, I've heard a lot about Lyme. I have a dog. The vets have been the people most concerned about it. That's how I know about it, from veterinarians. No other way. Ironically, I've been having my dog vaccinated against Lyme disease for years before I contracted it. I guess they're doing human vaccines. Anyway, this couple warned me about it, warned me how difficult it was to get someone to take it seriously and get treated. And I remember this conversation, and a reasonable person thinks, okay, you don't hear this too often. It's probably not as rare as this person's telling me. The exact same thing happened to me. I went to him. He was helping me more than doctors go through the process of how do you fight to get taken seriously, to even get tested for this, never mind treated. And you're fighting during a window of time. There's a window of time where these symptoms can kind of be stopped before I think you become chronic. I'll never do anything harder in my life, and I got through it. I lived to tell the tale.
But again, there's so many young people, and it's not, like I said, I'm looking at the video and seeing all these, older women, and the support groups are young men, mature women. The men are coming to the support groups, the men are contacting us. There was a 30-something at our last support group meeting who he can no longer work and is going to have to declare bankruptcy because he owned his own business. Can't work. So, you've got these stories that need to be known and need to be dealt with. We've got a problem. So, to kind of go back to where we were trying to get to some information.
Take over there, Donna.
No problem. It has to be told because that's it's a big problem.
That's the story too. The rest is even more outrageous.
Well, if we have time in the end, you can finish it.
Sadly, hers is not alone. I mean,
No.
Donna and I hear these stories constantly.
How outrageous
People
was it that
contact
I was
us all the
warned of
time.
this, and then the exact same thing happened to me by somebody young in Mahone Bay who had also just moved there from Ontario. Yeah.
That's sad.
I mean, that's a young doctor that just didn't have all the information.
Yeah.
Yeah. So,
Yeah.
so a couple of things, and this is not to be petty, but it is in a bit. We just want to kind of prove our points that we were trying to make that were kind of argued against last time. Interestingly enough, the information that was debated last time is actually on the Infectious Diseases Expert Group, Department of Health and Wellness Statement for Managing Lyme Disease in Nova Scotia. So it's the Nova Scotia document where it says that the laboratory testing is not necessary when you have the bullseye rash. And it also says that Lyme season, and in brackets it says anytime temperature reaches 4 or higher degrees, ticks can be active. So exactly what we were trying to say last week, that was kind of debated. So I just wanted to bring to the attention that particular document and what we were trying to say. And I realize people, again, don't have to know everything, but when you're debating an issue, perhaps you should have your ducks in a row. And that may be, like I said, a little petty on our part, but we have done our research. What was that, Brenda?
I'd like to say something. Yesterday, I took part in a CVMA webinar. That's the Canadian Veterinary Medical Association webinar. March is Tick Awareness Month. I worked 30 years as a vet tech. Guess where I got this? Anyway, what they're saying is somewhat different than what Dr. Strang was saying. And in Atlantic Canada, ticks are active year-round. You can get a tick on you in any month, maybe not every day in the cold winter when it's really been cold, but every day. And I talked to one of my vet friends this morning, and they had 2 dogs diagnosed with Lyme last week
Yeah.
here in Pictou County.
So
it's here, and it's not going away.
That's right.
and it's not
You
just
have to
an ad
learn to
in the
live
script.
with it and work with it, treat and diagnose it.
Thanks, Brenda. I actually brought a little bit of that because I did tape a bit of it today. I got a chance to. But it is. The ticks can be active all year. I mean, not winter of 2014, I remember a case of a woman that had gone, you know how beautiful our winter was in 2014? And she had gone looking for her Christmas trees, a Christmas tree in December, and ended up with a tick, the bullseye rash, and got Lyme in December. So it's not just a spring awareness program, it's an all-year thing. So we just wanted to mention that was the information. We also wanted to mention the Canadian Adverse Reaction Newsletter, Volume 22, Issue 4 of October 2012, which specifically mentions Lyme disease test kits and limitations. And it mentions that the serological tests are supposed to be supplemental to the clinical diagnosis and should not be the primary basis for making diagnostic or treatment decisions. And it mentions that the test kits have sensitivity and specificity limitations. And it also, interestingly enough, it mentions here that a negative result does not exclude the infection as the cause of illness. And it does mention a couple of other things that could cause a negative test, which was quite eye-opening when I first read it way back in 2012. Because if you've had antibiotics, it can affect the efficiency of the test. And so many of us...
Really?
If so many of us had been treated for other things, all of us that didn't get treated right away because we weren't aware of it, we were probably treated. I mean, I had strep throat, I had pneumonia, I had urinary tract infections, I had a whole number of things. So I had a considerable amount of antibiotics working up to when I had my ELISA.
The first doctor I saw, might have been, I don't know how that works, but she told me very concretely, I know what's wrong with you. You have a bladder infection, and prescribed me antibiotics. I had Lyme disease, but that's interesting.
So, I mean, but the Lyme disease can cause, once it's in your system and it's affecting your immune system, it can cause all kinds of things, as we all know.
And
so
it can and probably will affect every organ in your body.
If it's in there, So that is information saying that the test, especially in our cases where we did go longer before diagnosis, the reason why we had a negative ELISA.
The other guy, Chris, who was diagnosed with Lyme carditis, and actually that's amazing medical work because this guy had no other symptoms. No fever, no rash, no tiredness.
Just the heart block.
The heart problem. And some doctor here in Halifax, I believe he told me, was bright enough to say this was a young, healthy guy. Why would he have, what was it they said, like electrical connectivity problems with the heart? It wasn't the actual heart organ being attacked. And thought to test him for Lyme disease. And the first one came back negative, but he explained to me, I didn't know how the test worked, that it was so close to what they will consider positive. There were two numbers, I don't understand how it works, that they tested him again. The second one came back positive. I don't know how that works. Nobody ever tested me twice. I don't know what my numbers were. Was I close? Was I, I don't think there was any doubt that I had Lyme, and I was negative too.
I mean, mine just came back.
So you had an antibiotic very close, however, to when you likely the disease started.
I would have contracted it. I should have had my medical records. I only found out about that a couple days ago. I will give you access to all my medical records.
No, just out of interest.
I would have contracted it in April or May of 2014. And the first time, I remember it was about a month before I had any symptoms. Nothing at first. And a month later, it was like I had a really bad flu. The biggest symptom of which was a raging fever, like drenched in sweat for 24, 48 hours. Then it went away. Fine. Again, it was just the flu, I thought. But I don't think there was anything much for another month. Came back again. And then it just kept progressing. The symptoms were crazy. I don't even remember all of them now. But towards the end, I knew I was dying. Your body knows when it's dying, whether anyone is proving it medically or not. My skin was yellowy. I think my face was feeling very stiff. I would wake up and weird things would happen. Like I couldn't move my arms one day above here. Just couldn't. I don't remember there being any pain. Just, they wouldn't go. Joints became very stiff, rashes all over my body, but not a clear bullseye rash until the second day I was hospitalized months later. It's a fun disease, that Lyme.
So you were eventually diagnosed by
A
after being
cardiologist.
hospitalised by a cardiologist. So,
Cardiologist.
so there's a good news story at least that you finally got
Well,
diagnosed.
the
but
really interesting thing was they said, oh, we've seen this before. So a cardiologist has seen, I don't know how many, I didn't ask, I should have, so many cases of Lyme carditis or Lyme affecting the heart that's becoming a way on the South Shore in Bridgewater to diagnose this. This guy, I forget his name, he was a good doctor, saved my life, two of them, two cardiologists while I was there. He probably knows more about Lyme than infectious diseases. Remember, he was calling them, contacting them, but he'd dealt with this before, he'd seen it before. He knew right away what it was.
Very fortunate. Again, it's
Yeah.
the doctor.
Yeah,
If
he
you're
was-
lucky, I mean, the So Shore, as you mentioned, and as Dr. Vaughn mentioned, it's a pretty bad hotspot. I mean, probably pretty much there's somebody in every family that's been dealing with it. But there are a lot of other hotspots that the doctors, I guess, aren't even aware that they're hotspots yet, and even in endemic spots that they're not even fully aware of how much of an issue
As
is.
far as I know, it's a North American problem. Like the U.S. is having huge increases.
I agree. You know, it is slightly concerning, obviously, that you know,
Yeah.
a clinician in the South Shore wouldn't know about it because and it surprised me. I have to be honest. It surprised me because we've spent so much time and
to my
energy
family to
collectively.
be in
I know
Halifax
in terms of
because I thought these doctors down there would know about it.
educating
Yeah.
physicians.
I did that on
every year we do
purpose
that,
because I
yeah.
thought they
It's
would have
interesting because you
treated
went,
people down
yeah.
there.
I was about to take up a point, Minister, is you can never do enough in terms
Sure,
of
that's right.
educating physicians. So
Yeah,
we
I
need
mean,
to kind of keep on
for
with
example,
that.
one of my colleagues, Suzanne Wilkes-Croft, her husband, maybe roughly between 24 and 48 hours after having a tick on him, I mean, he went, diagnosed, treated,
Yes.
and has had no other effects since.
Now,
And that's the thing.
just a second, but I did hear that story, but I also heard doctor number 2 diagnosed and treated because Suzanne wasn't happy with what the first doctor said, so they went to a second doctor. That's the story I heard. So whether that's true or not, but that's the one I heard. That was the one that was going around the Lyme community.
This is what is so frustrating. If it's caught, diagnosed quickly, and treated quickly with an antibiotic, it's not a problem.
That's right.
It's
It's just
not a problem
minor.
at all.
It's just
Lyme
another,
is not the
another
problem.
illness.
It's recognizing it and treating it quickly within that window of time before it becomes very chronic and evolves.
I live in an endemic area in Bedford, and Department of Health has even put signs up that be aware of Lyme or tick-bearing Lyme disease in this area of ticks, and they come in on the deer that come from the D&D property where they're protected and live, deer that is. I had 3 ELISA tests, and they all came back negative. And so infectious diseases wouldn't even see me. They did consent to see me in the end, but wouldn't give me the Western blot test, so I had to go to the U.S. to get the Western blot test, and I went to the U.S. for 3.5 years. And I'm in an endemic area where we know, and Department of Environment and Department of Health recognizes that there's Lyme disease there. And I have
I'm
Lyme
a
disease.
confirmed case of Lyme carditis, and after I was done my treatment, after out of the hospital, after being treated by IV for Lyme, then 31 days of Doxy, which they then switched to I forget which other drug because the Doxy made me too nauseous. I was going to be regurgitating it, and that wasn't going to work. I lost my train of thought. Something you said.
Sorry.
Darn. It was good. It was a good point.
It was good, Paula.
But she actually still has symptoms.
Yeah.
Oh, infectious diseases. Finally went to my family doctor who knows me well and said, wow, you've been through quite an ordeal. I started having kind of symptoms that were coming back after my antibiotic treatment, the 31 days, after the other drugs by IV were finished. So I don't know how long in total they treated me for, but more than 31 days with the antibiotics. Started having symptoms that were coming back, joint swelling, joint pain, arthritis. It felt like this was still in my system to me. So I discussed it with my family doctor. She referred me to infectious diseases to see if they could talk. People can answer my questions. This cardiologist who treated me in Bridgewater, who was fabulous, amazing doctor, when I ask questions about what to expect, will I have problems in the future? We don't know. We don't know. We don't know. Should I have my heart checked on a regular basis after this? Maybe.
You were going to what the infectious diseases said.
Infectious diseases. My family a doctor, and I still laugh about this. They came back with, "We have no interest in seeing her." That was the response when I was referred to them for further treatment, or to ask whether I should be doing another round of antibiotics or what to expect in the future.
And my doctor, when my ELISA came back negative, my GP said at the time, they'll probably not want to see you because your ELISA is negative. This is what doctors
I
are...
suppose one of the issues, if we come down to it, is, and you mentioned a couple of is that all right?
Yeah.
You mentioned a couple of specifics in the the IDIC statement, and it's helpful to know those because they will need to be revised at some point. And of course, as I'm sure you all know, there's a lot happening around Lyme disease policy in Canada and internationally. So the IDSA guidelines are being revised, I understand. I don't know when they'll be republished, but that process is happening. In Canada, of course, we've got the national case definitions are being revised, and the public health agency is leading on that. And I understand that they're also leading on the revision to both the diagnostics, the lab testing, and the treatment policy. So there's a whole lot of stuff that we're expecting to come down.
Yes.
In the next while. I don't know when exactly all those will land. I think what would be very helpful is to have your comments, on the IDIC statement as well, so that we can kind of pool all of those. Because when we have this episode, our problem, of course, is that the evidence is evolving. It's incomplete. We know that. We don't have the tests that we would like to have for Lyme disease. We know that they're not sensitive and specific enough. So we are in a difficult position with Lyme disease. But as the department, I'm sure the listener would agree with this. We are committed to getting the best evidence-based policy that we possibly can.
That's
and we
great.
work with
That was my
on
question.
that.
Whether you guys think this is a concern,
Well, absolutely.
and what we're going to do about it in the future, because I would like to help other
I am
people
sure
so
there
they
will
don't
be.
have my experience.
I'm sure there will be issues that we continue to debate and to disagree on. Around the testing and around the sort of.
Do you think there's a possibility that with climate change, Lyme is evolving from what it was?
I think it's not a possibility. I think it's a raging certainty, to be honest with you. Absolutely it is.
Yeah.
And
Yeah.
the thing you mentioned about of course it's more the ticks are more active in the spring. Of course they are. But the spring and into summer, is getting wider. It's getting longer as global temperatures rise.
Anyone who has a dog is very
last week in my area in the valley, no snow, 16.7 degrees.
What?
16.7 degrees recorded officially in Greenwood, warmest temperature today. Just a very personal little quick note here. In my experience, and I live in a wooded area and high grasses and so on. I don't understand how anybody could have a tick on them for 24 hours. I have been awakened at night to take a tick off. And my wife the same, and I am an unbelievably deep sleeper. I do not.
Oh, you could feel
yeah.
it?
Oh, absolutely.
Where
I
does it come off you?
don't know how somebody could have a tick on them for 24 hours and not.
Now, the ones you
I
found,
asked
were
that
they a
question in
nymph?
hospital.
Were they a nymph, or were they, which size were they? Because if it was...
A couple were very tiny, but most were the crawly types,
Yeah, so I mean, if the ones that people get bitten by the most are the teeny, tiny ones,
Yeah.
and you don't feel them.
Yeah, I just was amazed that somebody, when I heard, look, they're going to be on you for 24 hours.
And they don't have to be on you for 24 hours.
No.
Actually, new research has come out
Is that
that
right?
that's the date. Like you'll read one document and they'll say 24 to 36, another one will say 48, another one will say 36, and then research came out and said there's really no known. And other co-infections can be transferred quicker. And that's another area which we need to get to, is that there are co-infections in the province. And the information that's getting out there is next to nil, unfortunately. But we're jumping ahead here, and I know, once again, we're getting
good.
close.
We're good. I'm fine.
Oh, I thought you had to leave at 3.
No, because the Veterans Affairs have changed the time that they're calling me today. Maybe Dr. Athman may have another meeting, but My phone call is a little bit later, so we do have
Oh,
a-
excellent. Thank you so much.
So I have to leave. I'm all right to 3:15, but I'm
Sure, yeah.
Okay. So I kept on cutting you off, and I apologize because I was kind of
No,
thinking about.
keep going through your list.
I asked him too.
But to go about the ILIAD guidelines and the IDSA guidelines, and we have said that the IDSA guidelines have been removed from the National Guidelines Clearinghouse because they're, I guess, out of date. They're supposed to be on the National Guidelines Clearinghouse. They have to be updated every 5 years, and they have to follow a certain guideline. So the IDSA Lyme guidelines have been removed, but the ILADS, the ILIADS guidelines, are still there. And at present, they're the only Lyme diagnosis and treatment guidelines on the National Guidelines Clearinghouse at the moment. So what many of us have said is, and I know you can't really say too much about this, but and which we're going to push probably a little bit more with the college and Doctors Nova Scotia, etc., is that doctors need to be able to look at both those guidelines and work with a patient based on both.
Yes.
It's not.
There needs to be some consistency in how, yeah.
They can't just be told that they can only do the IDSA guidelines when the ILIAD guidelines meets all the specifications and requirements to be on the National Guidelines Clearinghouse.
So just on that, I mean, you're absolutely right. It is the only one currently on that, but it really is only a clearinghouse. It's only a resource.
But the doctors and people go there for,
and
yeah.
as the IDSA guys are taken down because they're currently in the process of being revised. What we expect our clinicians to follow, of course, is the IDEC, which is based on IDSA. Absolutely, it is. As is policy in the rest of Canada, as is the policy in the communicable disease centres in the US. So we're not inconsistent. We try, and it's very important across Canada to be consistent in approaches. And it would be difficult for us as a province to switch to a different set of guidelines.
Well, you're not switching, but being open enough that doctors can utilize either one by telling their patients there are two guidelines, and I mean the patients need to know that there are options and not be told that they fit in this one little guideline where they get 2 to 4 weeks of antibiotics and you're cured.
So our guideline obviously is trying to synthesize the best practice from all the guidelines that are available, and the IDSA is the standard that is used across the US, across Canada.
Is that the protocol for? When I mentioned that, I wasn't sure this person had emailed me this because he had to go into doctors and give it to them when he was fighting to be treated, and he was eventually diagnosed with Lyme. His test came back positive. But he emailed me what I remember is the protocol for treating Lyme in Nova Scotia. Is that what you're talking about?
Well, this is what Nova Scotia kind of follows, the IDSA and guidelines.
And it was a list of if you meet these A, B, C, D criteria, you are not to wait to treat this person. Give them the antibiotic before getting a positive test. You're not supposed to wait for that to come back. I finally ran in, started seeing many doctors, printed this off, and went in with my yellow face, barely able to walk, couldn't eat at all at that point, to the Lunenburg emergency with this, prepared to save them. I'm a very polite person, and at that point I had lost all politeness. It was, hi, here I am, I have Lyme. Here's the protocol for treating it in Nova Scotia. Give me the drug, don't wait. And at that point they could see my heart was, they didn't even know how I was alive anyway. But I guess when I'm listening to this, no doctor I met with, and I met with a lot, knew that this protocol existed. Never mind, we're following it. And Dr. Strang mentioned that in your last, that they know that this protocol exists and they don't have to wait for this test to come back positive. No doctor, no GP I met with knew that. They didn't know. Nobody's following that.
So I mean, I think we acknowledge that we always need to do more around professional education. We do circulate the IDEC statement. We have circulated that many times. We do put a notification in Doctors Nova Scotia, which is a magazine all GPs read. The one magazine they do read, I think. So there's no reason why they shouldn't know. But of course, things always things could always go awry. But the point is well taken. That we always need to intensify our efforts around professional education.
I'm quite tenacious. I didn't stop with one doctor. I thought, let's try another. We'll try here. Then we'll try here. Then we'll go here.
And some people, I mean, just don't have the ability to do that. Whether
No.
they don't
Yeah.
drive,
No.
whether they don't have a support person, whether they don't have the money.
Or if they're
So
a child, or if they don't trust their own body and they're listening, you have a bladder infection, which, you want to trust a doctor with their education and their expertise. And I'm not a doctor. I want to believe what I'm told.
And there are a limited number of doctors to go to. And I know my first doctor dismissed me and told me to find somebody else to help me. And my current doctor tells me, I'm too busy, I don't have time for Lyme. And that she'd help me with other problems.
Well, and that's one of the things, too. A lot of the doctors in Nova Scotia, and this is kind of getting off the line, but onto the doctors, is that they have a one symptom at a time mentality. I mentioned this, I think, last week, that getting something diagnosed that's multi-systemic is almost impossible, or can take years in this province, because you go in for one symptom,
Yeah.
you go in for the next symptom, you go in the next symptom. Each symptom gets you sent to a specialist or sent you for a test.
Nobody will look at the whole picture for you.
And that's a huge, I mean, that's a Canadian-wide, it's an issue. And that's something that you guys can think about while you're working with, how the doctors are paid and how they react to difficult cases, because it is a huge problem. I said not just for Lyme, but any
And it's very
multi-systemic.
frustrating. These doctors are good people. They want to help. They're doing a great, nobody means to miss a diagnosis, but there's just a big problem with this issue in particular. For sure.
And with Lyme, like many diseases, the longer you wait to discover what the real illness is, the
The more
worse you
ill you
become.
become.
And then
Yeah.
it becomes chronic, and you have it for life.
Yeah.
And there we're getting into the chronic word. Can I just comment about that? Because one of the things I have here is the post-treatment Lyme disease syndrome, and the fact that many of us call what we have chronic, which really is probably just late Lyme, or late diagnosed Lyme, or but everybody keeps getting so wound up on what we call it, whether it's chronic Lyme or not. I mean, that's just a name a bunch of us gave, and now it's kind of grown into a thing. So post-treatment Lyme disease syndrome is if you were treated early on but still have symptoms. That's what post-treatment. That doesn't refer to people that weren't treated early on and have have symptoms. So, I mean, I've always kind of thought that if you still have symptoms, whether it wasn't an adequate treatment, or you also have a co-infection, which
I've
was
never heard that, a co-infection.
yeah. Lyme gonorrhoeas. Never heard of a co-infection. We have many in the province. It's online. You guys have documentation that we have quite a few co-infections in the province, but nobody knows about them. We've got the anaplasmosis. We've got the oh my gosh.
Babesiosis and
I was
Bartonella.
going to say, yes, Brenda, thank you. I have both of those co-infections along
Yeah.
with Lyme disease, and my doctor in the U.S. diagnosed that. I would never have gotten that diagnosis.
And you mentioned the sweats and everything, I'm thinking, possibly babesiosis. I don't know. I mean, we're obviously not doctors, but because we've read so much, it's starting to become quite second nature for us to start questioning everything.
I tried to stop reading. It was just scarier and scarier. All I went by was my own experience.
Well,
The distinction is a helpful one, I find, because thinking about post-treatment disease syndromes is it's not exclusive, of course, to Lyme disease. There are other infections that can cause lingering disabilities. I mean, absolutely,
Yes.
and I think any physician would accept that and appreciate that. The difficulty comes when we start thinking about, is this a persistent disease? Is the bacterium persisting, and does it require prolonged courses of antibiotics? And as we understand the evidence, it really doesn't. There's no benefit from prolonged courses of antibiotics.
well, I mean, there's quite a bit of new research.
So although I absolutely take your point that people who have Lyme disease can have symptoms long into the future. We just don't know enough about how to.
That's the thing. We don't
about
know
the
enough.
process.
Who's going to figure this out?
Well, there are research questions here. Absolutely, there are.
Don't
Well-
you think we should establish something here in Nova Scotia? Because, there are a lot of cases. We could be a leader in Canada.
You know
Devote
what?
some money to some
We're a
research.
small foreign province. We're a population of 1 million. There are, the communicable disease centre in Atlanta.
It's just
The
not
US
realistic.
is the kind of place where you'd expect that kind of research to be done. We don't have the population base or the capacity.
The research is being done, a considerable amount.
Absolutely.
There's a lot of research that's been going on lately about the possibility of biofilms and persistent Lyme disease. So that's happening, and that's out in the research field. And you're not on my email list yet, but if you want to be, I can include you.
Because the great thing is, of course, all of this research is what will inform the update of the of the guidelines of the Infectious Disease Society of America, and that will be a kind of critical thing that we need to keep a very close watch on, and it will inform what the Public Health Agency does in terms of the guidelines for diagnosis and treatment. So there are people pulling together all of this research, and I hate discussions where we bandy bits of research and counter it with another bit of research, because it's not our job to do that. It's our job to keep it informed of the research, but there are people who are synthesizing that research and bringing together as best possible evidence, and that we believe is our job in the department, to really understand the synthesis and what the whole body of evidence is showing us. And we're committed absolutely to continuing to do that.
And I appreciate what you're saying, but that leaves those of us that have it and the people who are still getting it, and there are many, many in this province alone. What do we do in the meantime? Because people are getting sick, young people, kids are getting sick, and it's almost criminal. I'm not making any accusations, but it shouldn't be happening. And what can we do as a group with you people to try and prevent this from happening, so that people can get treated right away, so it doesn't become
That's why I'm
chronic?
here. I don't want it to happen to anyone else, especially a young child. What happened to me, and for them to be disabled for their whole life, just from sick.
So do you have a primary health care provider now? Like, you have a
In
doctor or
Nova
a nurse?
Scotia?
Yes.
Yes, I do. A wonderful young doctor. I changed doctors. I have a wonderful young doctor. She acknowledges that I have Lyme disease, but she can't treat me for it. So that's why I went to
She
the
feels
US.
she can't treat you for it because of
she's
the
not
worry.
knowledgeable enough, and also she knows that what the protocol is in Nova Scotia for treating people with Lyme disease. Because I wasn't officially recognized as having Lyme disease here, even though I am tested.
But I found that some doctors were almost afraid. They didn't
Yeah.
want to do anything that might get their license taken away, even if
They are afraid.
Oh.
They are. No, my GP, I've been going to the same GP since I was about 19 years old, so it's been a few years. And today's my birthday.
Happy birthday!
But she has said on numerous occasions, once my ELISA came back negative, there's absolutely nothing she can do for me. Initially she said I should go to a place like the Mayo Clinic, and if I get a diagnosis down there, she's allowed, her words, to treat me. So, and when she saw that I was getting better on the protocol I was receiving through Dr. Boucher, who was in the province at the time, and she saw I was getting better. She actually went to school with Dr. Boucher and said, "This is great." And then when he closed his practice, she once again said, I saw that you were getting better, but I'm not allowed to do anything. So they're so worried, whether it's they really are in danger, or don't know, or they just think they are, or because Dr. Boucher closed his practice, they all think that they
There's a lot of
can't do anything.
And fear and misinformation about Lyme too. Like this, oh yeah, that's what I was going to say. This, I heard that too, just word of mouth, I don't know how, that there's no way you could contract Lyme disease, even if you had this deer tick on you, which I found on me, unless it had been there for at least 24 hours. No way you could contract it. There is no way that tick was on me for more than 12 hours. It was in a spot that I shower every day. I could miss it. So I remember thinking that. I found the tick. I'd heard these stories. I was aware of Lyme disease. My dog was vaccinated for Lyme disease. Thought, I'm not going to worry about this. There's no way.
And actually, this is taking me off track
Newark
again,
is
but
an area rampant with Lyme disease, according to people who live there.
every time you talk, something else pops into my head,
Yeah.
which is scary.
Same
but
too.
but I'm actually speaking in Mahone Bay this month at the Mahone Bay Center along with Dr. Boucher. And as part of this preparation, I was in a meeting with somebody from Mahone Bay who was giving me some stories of people that she had spoken to that had had the bullseye rash, had flu-like symptoms, but when that all went away, they thought they were fine. They were never treated, but in their head, Lyme was just a rash and flu-like symptoms, and once it goes away, you're fine. So these people may, days, weeks, months, even years down the road, might start getting all these weird symptoms and go, what the heck? And never have it equated to the bug bite from way back when. I'm pretty sure the bacteria doesn't just disappear. I mean, some people
No.
seem to be able...
Whenever my immune
What'd you
system
say?
goes down every month, I get arthritic. My symptoms come back a little bit. It's like it's just there, waiting for my immune system to go down every month. Happens like clockwork. Or if I get a cold.
Is that damage because of having had Lyme disease? Because I've heard that's a thing too.
I
Or is
believe
it
so.
actually remaining disease?
I don't know. That's the thing. And nobody...
The
nobody
test
would
can't
address that
prove
before.
whether there's a new... and
Infectious diseases
Yeah.
is not interested in speaking to me.
so.
The doctor and I laughed at that one. Like...
But these people think they're fine. So, I mean, I think some people can fight the bacteria better than others. Some people can have it in their system for a long time and never have any
Yeah,
symptoms
I
whatsoever.
wonder, like he said, if it's in my system, just there, still on a low-grade level, and if anything brings my immune system down, suddenly my hands are very arthritic, all like
Stress
have
or
recurring-
physical
yep,
illness,
recurring-
Reoccurring stress. The Lyme bacteria hides in biofilms or in cyst form, and stress can bring it out. I know of somebody who was in a car accident, young fella, planted trees in the woods, had numerous tick bites, was in a car accident, got really sick, and passed away from Lyme disease.
It's so sad.
We got a great resource on the line here.
I mean, Brenda has been at this for a lot longer than I have, and she's been dealing with a more severe case. Plus, she got hers through work. But she's been fighting workers' compensation for how many years there, Brenda?
Far too long, and I know of others fighting workers' comp and being ignored.
Yeah, because it's not an issue in the province. And that was actually one of our questions on our last week is workers' comp needs to be made known that this is an issue in the province and that people can get so ill to the point that they can no longer work. So that's got to be something
That's got to change.
yeah. So I mean, she's been fighting at it for eons, and she was a vet technician, and a lot of people you'll read different articles about various vets and different people getting it, and we don't really protect any of our forestry workers a little bit, but in the U.S., I mean, to go in the woods now, most of the people have permethrin treated clothing to go anywhere near the woods. We don't have that. We can't even get permethrin-treated clothing in Canada. So, I mean, there's a lot of things to do, but workers' compensation is a big place where more awareness can be made.
I wanted to answer your question about how you could have a tick on you and not know. I actually asked them in the hospital, and they told me a couple of good stories. Some of the nurses who are dealing with people who are in there or hear the stories. These little buggers, no pun intended, are very clever. They're very good at crawling into body crevices, or you guys probably know that already. When they access your body, they're looking for places that you won't find them, like under armpits,
warm
or
and moist.
They don't stay where they're really obvious. And they told me in the hospital that there was a young man who was mortified but had had one crawl inside his private area. I don't know how you would know. Felt it maybe. They had to dig it out. They're very crafty. This other guy, Chris, who was diagnosed with Lyme carditis, had no memory of ever having a tick on him before.
So it's very common not to ever see the tick, and that's probably the group of people that we're dealing with the most. the ones that never saw the tick, never saw the bullseye rash, but have had a developing number of symptoms. And I'm going to skip.
Sure wish I'd seen smiling buttons.
So one of the things I think is a misconception or misperception is that Lyme is difficult to diagnose because there's so many overlapping symptoms. But the diagnostic form used by Lyme doctors, knowledgeable, Lyme literate doctors through ILLIADS, require a very comprehensive diagnostic form. It's not just, oh, you've fatigued, you have Lyme. Oh, you have swollen knees, you have Lyme. They don't do that. You have to do a very comprehensive form. So what I have here is a compilation of 4 different Lyme literate doctors' diagnostic forms, which is listing all the symptoms, listing in what degree you have them, when you got them, going back to even personal stuff. So it's not like, I mean, I hear people, but we can't diagnose it clinically because there's so many other diseases with the same symptoms. And that is if you're only diagnosing based on 2, 3, 4, 20, 30, 40. I had 48. I don't know how many you had.
I had
It's
in the
not
40s,
just.
my 40s.
Right.
So if you know what you're talking about, you don't just, like I said, you're not misdiagnosing people. I mean, there's a couple you'll hear, but I mean, it's on the other side as well. There's people probably being diagnosed with things that really have Lyme disease. You know,
Yeah,
the
I think that's true.
fibromyalgia, or
Yeah.
there's any number of things that they might be being diagnosed for that it's probably Lyme disease. But it's like I say, it's really hard when you know what you're talking about to misdiagnose. So we really need in the province Lyme literate doctors, ones that actually can
Who are
sit there.
knowledgeable and who can catch it right away, so you stop getting all these chronic cases.
So, I mean, you know, we're not here to have an argument.
No,
but,
no.
but,
No.
but,
No, we're not.
but the idea that you know, you have a specific subset or a subspecialty of doctors who you know, who can treat Lyme disease,
And not just Lyme, tick-borne
with-
diseases.
with the kind of protocols of the evidence base, which you know, we've tried very hard to assemble. You know, it doesn't really stack up to us. Because for the same reason, you know, even though you may have, you know, 30 or anybody may have, you know, a large number of symptoms, but they're all common symptoms, and so there is still overlap with
Sorry, did
other
you say
chronic
you
diseases.
have tried to assemble a group of specialists?
Well, we have the infectious disease expert group here,
Yes.
and they are the.
You need to talk to this cardiologist in Bridgewater.
They are.
I think he's the Lyme expert now, just from seeing cases.
So you know, they are the experts that we turn to in infectious diseases, in microbiology. They do keep abreast, obviously, of the literature, all of the literature as it emerges, and really as a province, we have to take their advice very seriously. You know, we will be updating the IDEG statement. Of course, we will. We need to do that periodically, and when new evidence comes to bear, we need to take that into account. But I think, you know, to go back to my point, all of these big pieces of work which have been being done, largely in Canada and the US, because that's where most of the work is being done, that will inform our updating of our guidelines. And I think that's kind of where we are as a province, really.
But, and I appreciate what you're saying, and I'm sorry because I know I interrupted you, but
No,
I need to
no.
get this out. Infectious diseases have turned down so many people and wouldn't even see them,
They
myself
refuse to see
included.
me or answer my question.
And I know so many people who have Lyme disease and went elsewhere to have to get treated and diagnosed, and they went to infectious diseases, myself included, once again. And I think
Yeah.
you experienced the
get
same
to the end of
thing.
the road and you
And
still
clearly
have
I can't
questions,
speak to your-
and there's nowhere to go at this
Yeah.
point.
Clearly, I can't speak for your individual circumstance, but you know.
But I'm not the only
as-
one. That's what I'm
As
saying.
a kind of generic issue, I think it would be fair to say that the ID doctors feel that what we currently know about Lyme disease means that individuals with, you know, call it post-treatment syndrome, whatever, that there's really nothing much else that they, as an infectious disease expert, have to offer.
That's what they
And
say.
really, then it's for general practitioners to support people and to help people and to work through the treatment and management options, because they believe very clearly, in the statement that they put together, it's articulated that prolonged courses of antibiotic treatment are not warranted, and there's no evidence base for providing them.
There is evidence.
So,
Well,
as
I'm
treating
evidence of
clinicians, they
that.
don't, it's not their job to manage the chronic symptoms post Lyme disease.
But okay, maybe you weren't listening, or no, maybe I didn't articulate well, trying to separate the post-treatment Lyme and the people that were never diagnosed for days, months, weeks, years. There's two different things. There's the post-treatment Lyme who were diagnosed early and were treated and still have symptoms, and they're not sure why they still have symptoms. I can understand that. And then there's people like myself who took years of specialists and tests before I was ever diagnosed, and during that time all the symptoms are building, and basically every symptom is impacted, including neurological symptoms, heart symptoms, and everything. So they're two totally separate groups of people. Post-treatment people, caught early, treated, still have symptoms. I'm not sure why, whether the treatment wasn't long enough, whether they have co-infections, whatever. And then us, which I say us.
Yeah.
But
I think I was. No, nobody seems to know. They can't tell me that I was kind of caught within the window of having it progress.
so
I feel very lucky.
it's the people that we speak to the most are the ones that have progressed and didn't get treated early enough. And so we really need doctors that are Lyme literate, that know the co-infections, know the different symptoms, know what different. It's not just one antibiotic that they throw at you. There's various treatments. The Iliads, I don't know if you've ever read the Iliads guidelines, but they're very comprehensive. And there's numerous doctors. I mean, there's now doctors in the States speaking quite openly. Dr. Neil Spector, who required a heart transplant because of his Lyme carditis not being diagnosed early enough. There's various doctors that are speaking out now about the issue. All the doctors on Iliads cannot be considered. Why would they not be respected as much as the doctors on the IDSA? They have two different mindsets, but they don't work together. And why we would listen to one and not the other is, I'm not sure why that is the case. We should be having the option of going through both guidelines, and doctors going through both guidelines and saying, okay, my patient has all these symptoms, and they didn't get treated early enough, so I'm going to treat a little bit more aggressively. There's many illnesses where they treat aggressively. And why Lyme has this stigma that it shouldn't be, I'm not sure. I think they need both talk.
Is part, Don, I hear what you're saying. I mean, is the profile, down the road 2, 3, 4 years later in terms of the symptomatic profile, I mean, is it just so broad that also it does cover a number of other possible diseases, and that's what makes some of the complications that doctors do have?
One of the things that I think that the Lyme literate doctors look at, and it's kind of weird because we're all different. We all have different symptoms. I mean, we have some that are, similar, but we can all have different symptoms. It affects, depending on where it goes and what it does. But one of the things that seems to stand out quite frequently is that the symptoms come and go.
Yes.
Thank you for coming.
Oh, thank you very
Nice to
much.
meet you.
Thank you very much.
The symptoms come and go. One day your left knee could be a problem. The next day your right elbow is a problem. It's like you almost...
Yeah.
We were talking on the way in.
It migrates around the body.
Yeah.
That's a classic sign of Lyme. Migrating.
It's weird. We all look like we're lunatics. And it's true, because when you try to explain your symptoms to people, we were talking about on the way in, anytime I try to verbalize some of the symptoms and things, I listen, like you're listening to yourself going, no wonder people don't listen, that don't really know about the illness.
All over the place. And then one day, you were complaining about not being able to lift these arms, and then the next it would be something else and they'd be fine. It was very strange, very confusing.
And you feel like you said, Don, like, I sound like a crazy person.
It's very
And I
difficult.
know I'm not.
Yeah.
And even my husband would say, so what's wrong with you today, did you say? You know, and thank goodness he was supportive and,
Yes.
and he understood. But, I mean, so many other people, if you don't know them, if you go to a doctor that you don't know, even your doctor that you do know, they start to think, well, what's wrong with this woman? Last week she had
We're all
this week
nuts.
she's got this. Yeah, we're all crazy.
And
And,
that-
we know
and-
we're not.
And I know it's women sitting around the table, but there are a lot of men dealing with it as well. So, I mean, we just happen to be
Maybe women are
we're the
more
most vocal.
So, Donna, before we wrap up, could you kind of, or all three of you first, that goes, Donna and I.
Or,
Sorry about that. Sorry about that, we have an expert on the
Keep
line.
speaking up, Brenda.
I just know a little bit and I want to help.
No, we appreciate that, Brenda.
No, thank you, Brenda. What would be that 1, 2, 3? I mean, I see a big area here that, and to be honest with you, other than I think with Dr. Sullivan, when you and I had met before, he was the former president of Doctors Nova Scotia, but I've never, gotten that full kind of briefing or presentation on what Doctors Nova Scotia, have been doing, need to do, and don't seem to be doing the full job on, okay? So, I mean, that's something that I can commit to. Tracy and I, we meet with Doctors Nova Scotia once a month. And we can put it on as, okay, we got 2 topics today. One is Lyme disease. We're going to have a significant thought. Plus, I personally believe you need to get in front of Doctors Nova Scotia.
They wouldn't meet with me when I tried.
They
but,
wouldn't?
But that was a couple of years ago, so I'll try again.
No, I'll tell you what. No, here's what I'll commit to. When they come to meet us, Tracy and Tracy keeps notes. But I will ask Dr. David Miller if he or one of his medical associates would meet with the advocates of Lyme disease.
That would be excellent.
I believe you need a takeaway from here, and that's one thing I'll commit to. But I just would like for you, because there's no question more needs to be done. And Doctors Nova Scotia and Dow Professional Development, all of us are to be partners, and I think this could be one of the real wins out of the conference, and also on rewriting the diagnostic, the treatment protocols. I absolutely believe that, look, we won't make progress unless all of us are into this, and if we can get even 3 or 4 ministers of health. And we have started too more regular meetings with the ministers in the 4 Atlantic provinces. The deputy ministers now have a pretty well a year-long agenda that they're working on, and we can raise it at that level as well. And so, but I would like for you just to give me the 1, 2, 3. I'm raising an area that I think is like many areas. We need medical leadership. We need medical leadership on this
That would
issue.
be great.
With your discussion with the Doctors Nova Scotia, it would be interesting to see, it was 3 years ago now that I met with the college.
Yes.
And I met with Dr. Gus Grant.
Yeah.
And it was just him and I, and unfortunately I didn't have one of these at that time, so
And you didn't have Brenda.
and I didn't have Brenda. It was just him and I at the time, and it was early in my
Yes,
my
fine.
development. So,
Yeah.
but he told me straight out that he couldn't allow doctors to clinically diagnose because there's so many overlapping diseases with the similar symptoms, and he said he could not allow doctors to diagnose, and that there was a lag time between emerging illnesses and the science-based medicine required to adequately diagnose and treat. So I said, okay, so I'm in that lag time, and so at that point I said, well, okay, we've got to make sure that the research is going fast and being distributed. That's why I kind of started my health email list and sending out any new research so that this lag time of 20 or 25 years or whatever it's going to be shrinks. So that, we've pretty much come to the conclusion we're going to be dealing with something pretty much for the rest of our life. We're just not going to clear it out. And now, I'm in menopause. So add the 2 together and this is what you got. But so that the college may be impacting what the doctors are doing and saying.
Yeah. But it's important that because the college physician and surgeons, I mean, they do have they have a different role than Doctors Nova Scotia. And Doctors Nova Scotia can in fact be the architects of certainly greater discussion, dissemination of information. Those are absolutely areas, because I've dealt with a couple of areas just even in the past 2 years where I said, look, Docs Nova Scotia need to take this issue and make some things happen around it. So it'll be interesting to see how they react to this in terms of an ask from the advocacy group, and maybe even bringing in a few doctors who are dealing with more cases, because again on the South Shore it is that annual hotbed. We know Bedford now and several others, and I know this year there will be some of the surveillance, like will be in Pugwash is one of the areas, Wallace, Malagash, and
Please not in August.
I'm
Okay.
a doctor, but how can there be a preventative vaccine for Lyme for dogs and then for humans?
Yeah, that's a great.
People were joking with me. You should,
I wouldn't take one, I'm
you
sorry.
should have gone to a
I wouldn't.
veterinary.
How can there be a vaccine for dogs and not people?
Yeah.
There was a problem with the human vaccine in the
There was
States,
one. No, there was one.
Continued. And in some countries, I believe in Germany, they do have a vaccine for people.
But that's just Lyme disease. So to me, a vaccine kind of makes people think, oh.
On top of
So
it.
wait a minute.
Yes.
The vaccine for
So
dogs.
so I'll do the Docs Nova Scotia piece. So what would be a 2, 3 from you and your group that we could give some focus to?
Well, I mean, there's so many different levels. I mean, in our case, of course, we would love to see a Lyme literate doctor, a doctor trained through ILLIADS.
Through ILADS.
ILADS.
Dr. Ben Boucher was ILADS trained.
And yes, I mean, he's gone now. So, I mean, we need a doctor that has an open mind and is trained in the co-infections and in Lyme disease. That's for those of us that don't see the tick and don't see the bullseye rash. We need, obviously, more awareness.
So you guys never had any treatment for Lyme?
Yes, but not through standard.
No,
means.
but not through the acute phase, right?
No.
Or,
No,
yeah.
no, it was
No, it
long
was-
after.
yeah.
For me, it
And
was
mine was
2
long
years
after.
I
Yeah.
would have been dead, jeez.
Yeah.
I really got a good case.
Yeah.
Progressing
So were
very quickly.
were you considered in the no, you were outside of the acute timeline as well, probably.
They told me something
Level
about-
2. You were level 2.
Yeah.
Yeah. I was into 3, 4
Yeah.
months.
Okay. Yes.
I keep on forgetting, and all of a sudden there's a...
I know, voice
Right.
of God.
So, and I mentioned this before, awareness, because there's so many people still not knowledgeable about it.
It's just stunning that people talk about this in these communities and warn other people about it, and then you go to the medical community, and it's like you're speaking a different language.
Well, we'll no, that's great. Yeah.
But there was something else I was going to push here, and I can't remember it now. Because unfortunately I have a Lyme brain, which has been affected by, well...
I find my brain is like that too. It just gets very all over the place, which is frustrating when you're an intelligent
So
person.
the first one is that, Minister, you're going to work with
Yeah, I'm going
Doctors
to ask
Nova
Doctors
Scotia
Nova Scotia to
meet with us.
see where they are on the
Yeah,
issue.
yes, good.
Would they meet with 2 or 3 representatives who've been at this now for a number of years and who have really educated themselves, significantly in the whole pan-Lyme kind of syndrome, because it's again, I'll tell you an area that is not quite the same, but. And it happened to be that I was having a meeting, had to run off to the meeting on autism. But across that spectrum of autism, I'll tell you, there is a myriad of presentations as well. It's not a one clear. It's not a one clear. Look, Mrs. Jones, we can help Jill because this is the prescription. Boom, boom, boom.
And understanding that
It's
it's
not.
spectrum
It
instead
is
of
not that way. It is, So.
That's why it's called a
Some
spectrum.
cases of autism are actually Lyme.
Well, and Brenda, I was just going to say that my doctor in the U.S., Dr. Maureen McShane, who is well reputed to be a Lyme sympathetic doctor and very knowledgeable, she told me that figures that she has read, 90% of children who have autism also have Lyme disease. So, which caused the other.
I read that just last
But,
night.
But
that's
I mean,
interesting that you brought
research is
autism up.
constantly occurring with regard to this.
So anyway, that's the piece. And,
That's the
and
piece.
then what, what is the plan? And this would be more at the med school, because you're right. I mean, new docs who are, and many new docs today are getting like a fellowship on emergency medicine so that they can cover off, because most docs today, our new doctors are being put on salary, and so some, more and more. We're now, I think we're closing in on 50%.
Not GPs.
Yeah.
Really?
GPs, and then also some of our specialists who also teach or do research, and it's called an AFP, or an alternate funding
I
plan.
think Nova Scotia should have a Lyme specialist.
So what what's happening at the Dow Med School in terms of that those 100 docs that are there each and every year, about 400, a little over 400 in the med school at the moment. What's going on? I mean, I think of 6 years ago when Tracy and I went and said, look, the time has come for a greater degree of training and education around pain management. And and it was just not on the curriculum. So that's an area in terms of again, before they're ever out in the field. But so I think that 1 and 2 are linked together, and want more around the awareness.
Can I just say one? And we have a problem with how Lyme is perceived in the province as being rare, as being a very hard to get, easy to treat, and that's coming straight from the powers that be.
I was told, you could not possibly have this. It's so rare. We're not even going to bother testing you for it.
And that's coming out of the mouth of
on the South Shore.
senior people, and they're quite frequently articulate in writing that it's rare, hard to get, and easy to treat. And a lot of doctors, and I'm assuming, don't bother to read all the information out there because it's rare, it's hard to get, and easy to treat. So they're not availing themselves.
Donna, that's a great point,
Yeah.
because it could very well be. I mean, if I have an hour tape on professional development when let's say I'm traveling as a doctor, and Lyme comes up, I mean, I may just skip the 10 minutes. Oh, that's rare, right? We don't have too
Because
many
you've got
cases.
too many other things that are
There's too many
prevalent.
other things.
And then I
There's
go
rare
on.
things.
Then I go on to the next area.
And that makes sense. When I went across the border, because in order to go to see my doctor in Plattsburgh, New York State, I flew to Montreal and then I got a drive across to Plattsburgh. At least 3 or 4 different occasions, when I was crossing and going through customs at the border, and they always ask you, what's the purpose of your trip? And I say, a medical appointment. 3 or 4 times, different customs officers said to me, so who is your appointment with? And I'd say, Dr. Maureen McShane in Plattsburgh. Oh, we know her. We get people from all across the country coming across the border to go see her. These are customs officers, 4 different ones. I mean, that's how prevalent Lyme disease is in this
And what
country.
if we could keep all that money in Canada and treat it here?
And get treated immediately before it goes
Before it
wrong.
becomes a big problem.
Well, look, thanks for sharing your story.
Thank you so much.
With us. Thank you
That
very
was my
much.
question, just if we could do something.
Yeah,
Yeah.
that's right.
That's great, thank
I
you.
heard you loud and clear. Yeah. Great to see you.
We
Thank
can-
you very
we
much.
can
Good to
let
see
you meet a lot more.
Thank you
Yeah.
for listening.
No.
Thank
We'll look
you.
forward.
Thank you.
Oh, you're welcome.
Take care,
Thank you,
Brenda.
Brenda. Good to see you, Donna.
Nice to
you
see you
very
again.
much.
Thank you.
Thank you
I've
very
got
much.
another package here for you.
Oh, okay. I've got your one right there. Look.
That's an all-new one.
Oh, right here. I brought it with me today. Yes.
Oh, and actually this one as well, which we didn't get to talk about, and it was one of the co-infection aspects.
Okay.
Was this one was specifically
Where's
about
this
the
coming out
dog
of?
ticks. That's dog ticks and Rocky Mountain spotted fever. So it's not just, I mean, I know we call Lyme.
So this was on CBC, this one, eh?
Yeah.
Yeah.
I know we say Lyme,
Yes.
but Lyme is very comprehensive.
Yeah.
It's like it's tick-borne diseases in Nova
Yeah,
Scotia.
that's what we need to maybe be referencing more, perhaps even, or as much of, right?
Yes, yeah, and actually, I'm not going to get into it, but
Yeah.
there's a few other vectors that they're now coming out with. They think it carries it. So
That are very scary.
it's very scary
very
research
scary.
coming out now with
Just so
mosquitoes and
everyone is
everything. So.
aware, if we wanted to devote some research money to it, I was reading that anyone with a science degree or an MD, even a studying student, can apply for, well, you're the contact on that site. If you go to the CAM Lyme site, you can apply for research money up to 3 years, $10,000 a year. Maybe a Dow could be looking into this right now if anyone applied for that. I would do it myself if I had one of those degrees.
Yeah, I mean, that research piece obviously is a significant part of
It's not,
How we
you don't want
handle
to blame anyone or it's just
Yeah.
we need some more.
And Dr. Vet Lloyd at
Sending
Mount
me
A
the link to
is
that.
definitely, she's doing lots of research, and she has her students
Yes.
at Mount A doing research and doing their masters. And
Who's that?
Dr. Vet Lloyd, she's a professor at Mount A, and Mount A sponsored the last Atlantic
Lyme Disease
Lyme Disease
Association conference. So,
in Moncton.
she's,
And that would be a
What's the
very-
dates of the conference?
May 16th and 17th, Monday and Tuesday. I'm going to be there.
Great.
I'm already booked for my
Oh,
flight and my.
Am I surprised? Or not?
Thank you very much
Okay.
for listening.
All the best.
Thank you, and there were a lot of
Yeah.
questions. Will we be
Yes.
getting answers maybe in writing for them?
Yeah, we'll have to see how we can tackle those, for
Okay,
sure.
perfect.
Okay.
Thank you very much.